Barbados has sustained control of the COVID-19 virus. The revelation from Minister of Health and Wellness Ian Gooding-Edghill as he addressed the presentation ceremony for the second COVID-19 Vaccine Hesitancy Survey Report 2022, attended by UN, UNAID, and high-ranking local medical officials. In expressing his thanks to UNICEF and to USAID, the minister told the ceremony at the UN headquarters the challenges of vaccine hesitancy will call for a political commitment and the financial investment of the private and civil society sectors.
The COVID-19 Vaccine Hesitancy Survey 2021 for Barbados indicated that the limited uptake of COVID-19 vaccines has been an ongoing challenge, hampering the response to the pandemic across the Eastern Caribbean sub-region. We in Barbados are very aware that engaging with communities and persuading individuals to change their habits and behavior is a linchpin of a public health success. Addressing vaccine hesitancy is no different. I am pleased to know that under the general findings in the report, of the 7 countries surveyed, Barbados was one of the least vaccine hesitant.
Chief Medical Officer, the Most Honourable Dr. Kenneth George, in his remarks, said children have not been the drivers of the pandemic, but acknowledged a survey of the protocols for schools was coming, but there is no more mandate on mask wearing.
We have a few, for example, the prisons and the geriatric hospital. Why? Because they are vulnerable populations. But, and presently, we also have mask wearing in the schools. We are examining the evidence though, and we will be making a pronouncement at another time.
Cadres was commissioned to do the survey. Director Peter Wickham gave some background on the elements of the exercise.
The Vaccine Hesitancy Index, and we now get into the core of it, is one of the key features of both studies. And the Vaccine Hesitancy Index was developed in association with UNICEF, specifically for this purpose, because we wanted to be able to track some of the critical information in relation to the issue of vaccine hesitancy. The methodology is pretty well spelled out, and I'm not going to go into that here. But essentially, we have a score and we have an ideal. So the score can range from let's say 10 to 1. The idea is that you want to have as low a score as possible.
During the study, social media emerged as a power, and government and other officials have been encouraged to harness that power and challenge those alternative outlets which may seek to promote myths and misinformation. Trevor Thorpe, CBC News.